Good morning, everybody. This is Dr. Amir. Today is Monday. We are talking about sciatica today. Thank you so much for all your interest and all your likes. I really appreciate that. A lot of you guys have asked if the topic for this week would be sciatic and if we can talk about that a little further and see what sciatic is, which is also in some cases is called piriformis syndrome. Um, the most important diagnosis that affects about over 80% of the population to one time or another is sciatic and sciatica. Sciatica is also known as piriformis syndrome. Piriformis syndrome, the piriformis is a muscle in a very deep gluteal region of our body underneath the gluteus maximus, which is the biggest muscle in our gluteal region, and underneath we have three layers of deep muscles, which one of those muscles is piriformis muscle. Now, I'm going to depict a picture for you, so it's actually very easy to understand, and show you on the anatomy picture that how it's very easy to uh, acquire that sciatic pain in a lot of cases. Runners or dancers or people that they sit on a hard surface for a long period of time, they can compress that muscle, and that compression of the muscle can correlate directly to the nerve being compressed. And when the nerve being compressed, as I have explained to you before, nerves are just like electrical cord, and they carry electrical impulse. And if there is any compression in that cord, then they won't carry the electrical signal 100%. It would be much lower than 100%, right? And as a result of that, you get that achy and that radiating pain going down the thigh, in the back of the thigh. So the most common cause of the sciatica is disc injuries, and I'll show you on a video right here. This is our anatomy for our back and our gluteal region. You can see right here, these are our lumbar spine, and off of each lumbar spine there comes the nerves. As you can see, those yellow, okay, there we go. Those yellow nerves that you can see right there comes off of the lumbar region and between each level of our lumbar spine. And when it goes down, it actually make up, when it comes into the gluteal region, it makes up the nerve, which is the biggest nerve of our body, which is the sciatic nerve. And that is that right there. The sciatic nerve goes directly posterior to our thigh and goes all the way down to the knee level. Now, the piriformis muscle is right over here. That, as you can see, the piriformis is that muscle which has direct correlation with the sciatic nerve. The sciatic nerve comes underneath that piriformis muscle. If that nerve gets impeached and gets compressed by that muscle. Now, if the muscle goes in a spasm, if you're sitting on a hard surface and that muscle right there goes in a spasm, it actually causes that pain and that irritation over that nerve going all the way down to the posterior of the thigh. Now, what can we do to treat that pain, or to treat that radiating pain? If it's coming from the piriformis muscle. It's actually very easy to treat because we just need to make that muscle to relax. If the muscle is a spasm or inflamed, we need to bring the inflammation down by variety of treatments, by either doing ultrasound over the area. Well, ultrasound usually penetrates about 2 to 3 centimeters down. We can put high power laser machine, which penetrates up to 10 centimeters, up to about 4 or 5 inches deep into the tissue. And not only it will decrease the inflammation, it will regenerate the new cells that are not working or don't have the energy to work. It will regenerate those cells. And one of the reasons why that muscle goes in a spasm could be directly correlated with bad biomechanic or misalignment of the spine. If there is not even distribution of the weight evenly on both sides, one muscle work harder than the other muscle on one side. If one muscle work harder, gets hypertrophy or gets bigger in size because of overuse or overworked activity. Now that piriformis muscle gets overused and gets bigger or gets inflamed and put pressure over the sciatic nerve. So I hope this clears some stuff for you and answer some of your questions. Now, one of the most common sites for sciatica or common cause of the sciatica is lumbar disc. If you have any stage of the disc, if the disc is protruded, the disc itself or the jelly inside the disc, it came out and it irritated those nerve roots. We also can treat the disc herniation at the clinic by decompression technique. Decompression technique refers to a specific techniques when we actually pull the spine apart for a specific level that you have the disc, and we create a vacuum phenomenon which cause that disc to go back in. And this can occur with few different sessions, but I have many patients that they're positively been relief of any pain or any symptoms that they had for many months, up to a year or 2 years. I had a patient with sciatica for about 20 years that came for about 2 months, and the pain has dropped down from the 8 out of 10 to 2 out of 10. So please don't hesitate to contact me if you like our page. You'll be updated for future sessions on Mondays, and you'll get better understanding of what it is that we do at the clinic. If you'd like to contact me directly, 678-401-3803. I appreciate all your comments. Please have them come, and I'll answer every single one of them. I look at every single one every day, and I'll try to answer as best as I can. If you need to contact me directly, you have my email, drbanishahi@aol.com, BANISHAHI, and at the beginning is D as David, R as Robert, at aol.com, drbanishahi@aol.com, 678-401-3803. We are in Atlanta at 1827 Powers Ferry Road, Southeast, Atlanta, Georgia, 30339. I hope this answered your questions. I'll see you later. Have a wonderful week, and God bless you all. Bye-bye.